Well, hello. What are you doing way down there? Oh, I guess I'm way up here. So I guess it works both ways. Well, we're not going to do the whole video looking at each other like this. But I've got to get down on your level for the rest of the video. So I figured I'd start way up here and look down. All joking aside, I'm Dr. Michael Hyland. For those who don't know me, I'm a physical therapist, owner of Hyland Physical Therapy and Wellness in lovely Broken Arrow, Oklahoma, green country where the spring is gorgeous and weather is very unpredictable. Be that as it may, today we're going to be talking about more self-treatment techniques you can do to treat low back pain if you're unfortunate enough to have this problem. Which, of course, it's an extremely common problem in the U.S. Last week, if you caught the video, we talked about sometimes it's just best to decompress when you have an issue of initial onset of low back pain. Sometimes it's best to just decompress, get into a relaxation position that will allow your spine to open up, relax, allow the muscles to relax a little bit because they're not working to kind of stabilize your back in that area affected. But then what's the next step? So you decided to decompress. So what? That's the title of this video. I'm going to show you what you can do while you're in that decompression position to start to work even more on getting your back mobile and just a slight involvement of the core, but not a lot, mostly for mobility. As you remember, the first two steps of my list are assess the situation and not the first two steps. The last two steps are number 3, keep moving, and number 4, keep moving. This is a way you can keep moving, or at least to start moving. So, pardon the view there. This is going to be kind of where we're at here. So last week I had set up a chair to be my decompression station, if you will. Did the same thing this week. And I just wanted to show you a technique that you can use to start mobilizing your spine when you're in a decompression position. This can be a really effective way to start moving your back and treating low back pain. So once you get up onto the chair, I would suggest starting in that decompression position. So again, just to review, we talked about a 90-degree bend at the knees approximately and a 90-degree bend at the hips in relation to the trunk or the lower body or the middle of your body, torso. And so once you've been in this position however long you want to use this as a relaxation position to decompress the spine, allow everything to open up, I had suggested initially 3 to 5 minutes. You can work up to 15, work up to 20, whatever feels comfortable and relaxing to you and relieves your symptoms. But now we can add mobility. So the what next part of the question is I would suggest adding a pelvic tilt movement to your decompression position. This is a gravity eliminated position. You can safely move. I mean, you can do this lying down too with your legs just bent, but I feel like this is also a really good way to do it with kind of a good position to learn how to do pelvic tilts. And you can do it with essentially zero compression on the spine because you're gravity eliminated. So putting your hands on your hips, in this position, your back is going to be pretty flat already, but you can enhance that and try to roll into a little bit more of a posterior pelvic tilt, trying to flatten your back into the floor. You can also go the opposite direction, by exaggerating that hollow of your low back and then going back to a neutral position. Now in my case, I have a resting position of an increased curvature in my low back. I have a little bit of a sway back posture, and so for me, flattening the low back is relieving. So I'm going to try to flatten and kind of stretch that lumbar spine into a flexed or a bent position. That's where you flatten the low back. And you can go into more extension by going the opposite way, and that's not bad because sometimes that extension position can actually relieve low back pain, especially with a disc problem. But again, kind of like we talked about in past weeks, you kind of have to explore what's relieving. Some people don't have pain relief with the motions you would expect. So explore that for yourself. And again, after you've decompressed in this position for 10, 15, however long minutes you want, I would work into doing 10 to 15 of these rolls or pelvic tilts, rolling back flat like this, and then arching the low back, and then rolling back flat, arching the low back. And I find with the position or with the support of the floor, it actually is a really nice stretch for the muscles all the way up into my middle back, and the spine too, not just the muscles. I can feel that in my joints. When you flatten your low back, you really do a good stretch for a good part of the spine, and it's a part of the spine that doesn't often get stretched. But that's my 2 cents. That's what I would recommend, and that's a good way to move forward with your decompression, your decompression type exercises. And you're kind of engaging the core a little bit when you roll that pelvis back and forth. But it's not perfect, but it's something I would suggest trying. It seems to work pretty well for some patients I've worked with in the past. And hello, whoever's watching live. I don't know, I can't see who you are. You named it and flash up. So do me a favor, leave a comment. Let me know who you are and say hi. I want to acknowledge your presence. The last thing I was going to say is we're not completely done with positions of relief and movement, but I do want to move a little bit into what you can do once you've discovered kind of movements that you can do and positions that relieve pain. Now we need to talk about what to do to prevent future injury and to shore up that low back area. Whether you have spinal stenosis, herniated disc, or just any onset of low back pain that you don't know what specifically is the problem. Really commonly, with any incidence of low back pain, there's been research-proven results to show that the deep stabilizing muscles of your back are going to weaken and atrophy. So, got to get the core strengthened. I see 2 of you live now. I don't know who's watching again, so please let me know. A lot of times I can see names pop up, but if your name doesn't pop up, I don't know. So say hi in the comments, let me know who's watching, and I appreciate you jumping on live during the video. We've been going for a few minutes now. I'm going to go ahead and conclude, but thank you for watching, and I'll catch you next week for Wellness Wednesday. As always, be empowered. Have a great rest of your week.